Just a second. Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors. And we are here to discuss a very special thing today, palliative medicine. Scope and opportunities with respect to the branch of palliative medicine. This being a new branch, there are a lot of questions and doubts around this. And so we are here with our special guest, Dr. Prarthna, discussing about the same branch. She has done her master's in palliative medicine and is also doing her fellowship in pain medicine from Kolkata right now, and is here to discuss her journey. Why did she pick up palliative medicine? How does she see the things changing with this branch? What are the kind of opportunities, as well as, what is the kind of lifestyle that if you pick up this branch, you can, have that. So welcome, doctor, to the platform. It's really nice to have you here.
Thank you so much, Dr. Ayushi, and thank you for giving me this opportunity.
Yes. No, our pleasure to have you here. So first, before just, wasting time getting on track, palliative medicine, a branch relatively very new, people are not exposed to this branch. Understanding the scope and picking up this branch for your masters is something. Why did you do, and how do you see this branch evolving?
Okay, so you said that the branch is new. Like I think the first MD program started from 2012 in Tata Memorial Hospital. That was where it started, and I think around that time I was doing my UG, but at that time I wanted to do something different. I think people are preparing for their NEET PG exam right from the third year and fourth year, but I just didn't want to do something very competitive at that time, and I was looking for options besides the mainstream medicine or just getting into surgery, some gynae or anything. So I searched for this and I wanted to somehow just do something oncology related. So I came across this branch and I somehow kept reading about it. And that's how after my PG, I took a drop a year to prepare. And yeah, I didn't add this branch as the first choice, but it was there. I knew the pros and cons of it. I had read about it. And then I had luck or what, I think it was destiny. I got the branch, I got the institute I wanted in Tata, and then I've chosen it. Been my path all this while. So after finishing my MD, I have done a year of SRship also there, and then now I'm pursuing my fellowship in pain intervention. So, and you asked me about the scope, right? So the scope. Uh, So now I think we all know that the burden of chronic illness is increasing. Advanced stage in not only just cancer, even in non-cancer, and it will just keep increasing, and the burden is going to keep getting overwhelming for the primary physician to deal with. So when things get irreversible and they have to just provide improvement in quality of life. So yes, we will be required with time. I mean, right now we're just a few graduates, so there is going to be definitely more scope in all the hospitals and medical colleges also. They are realizing the importance. So it is, every year it's doubling. The demand is, they are doubling. They really need us as specialists right now
No,
with the awareness.
that's actually very interesting and very, to know, especially now getting into the branch which has more need and, more opportunities, of more job opportunities. It makes sense to go there. Also, as you said, you already decided and you were researching about this branch. We very commonly say that the branch selects you and you don't select the branch. It goes other way around. It happens, through your, during your UG days only, that you have that affinity towards something, and so you search it. So that's actually nice to know. So, but you did it from, Tata's. What do you think are the other places to pursue this branch, and how can somebody who wants to go through this maybe build their understanding and then pursue it from which place, is what I want to understand. Because first, building your mindset and understanding towards the branch is also important. So how do you think, if anybody wants to go, should should research around this and then search for what places.
Yeah. So, the MD program was there since 2012, like I earlier mentioned, but since 2019 20, they have started DNB also. So currently, the status is like there are eight colleges offering MD, and there are eight colleges offering DNB.
Hmm.
So there is and it's the same through NEET exam. You apply, you put in your choice preferences, and you get it. That's how you
Hmm.
get in. And yeah, so how do you choose the institute? Is you, I think there are now Tata is known for its oncology, but we do get exposure to oncology, non-oncology also. So you have to, I think, do some research individual basis based on like the city you live want and everything. That all that criteria is important when you fill a preference. In need, the city you
Hmm.
want and the fee structure and all that. So you have to do some research on that. And
Hmm.
I personally, I have done my MD, so I can only speak for the MD program. The DND is still a new thing, and people are very approachable. And since we are just a few people, there are WhatsApp groups or something. It's easy to reach out to us, get
Hmm.
information about the DND colleges through the seniors or the faculty. Everyone is helpful.
Hmm.
I personally, I'm since I'm a Tata graduate, I would recommend that. But even AIMS and Manipal GCRI, because I have interacted with the faculty over here, they're also very good.
Hmm.
Depending on whether you can go for a private institution or a government institution, even that is something which you will have to consider. So you take
Right.
all those factors into consideration and then you fill in your list, and always choose the preference based on whatever your priorities are also. That is important.
Hmm.
You have to see which place has good academics, the clinics, the working hours, whether you
Hmm.
have good the seniors, and how the schedule is, the rota is, and everything. So all those things, I think, not just for any branch, not just my branch, but I think every branch you need to just see all that before while filling a preference order.
That's true. That's true. So, as you just mentioned, as you have been mentioning that you have done your MDR in palliative medicine, how was your time during your MD days? Because it's not it is pretty new now, and I'm sure you have a lot of memories still in your mind. So, how was the days? How hectic it is, and something that you want to share with students who might pursue this branch. How is the everyday life there.
Yeah. So I think when we are in our UG and during my UG at least there was not much talk about palliative medicine. People didn't even know about it. They just thought it was dealing with end of life or only with cancer. So
Hmm.
and also we are not that trained to see this uh, extent of overwhelming suffering. I mean, we just do our internship, just like drawing blood and doing whatever someone is telling us to do. So when you enter the branch, you will be definitely, you might, if you're in a high volume center, you will find it overwhelming to see that extent of suffering. Even though the resources, it's not like the resources were less, but it
Hmm.
doesn't suffice for the extent of patients that are coming in
Hmm.
Tata. So you do get a little, initially it is hard to adjust with all that, but I
Hmm.
think slowly you start adapting over time. I needed colleagues support. I had a very good HOD and good seniors who helped us out through that. So the first year we do the shadowing. The first 3 years, 4 months, we used to shadow our seniors and just see how the daily work. So you have the OPD. Along with that, you have emergency also 24/7. So one person is on call for
Hmm.
the entire day, 24 hours. And as and when there's an emergency, one person has to go to the emergency. Then there are inpatients also. So there is one person posted for the wards to see the wards. We also
Hmm.
have a respite center where
Hmm.
where some patients, the caregivers need a break from taking care of of the patient. You admit them there for some time.
Hmm.
So, and we also used to have home visits. So once a week, we would a doctor would go. We had to go. There was a rota for it. So all
Hmm.
that, along with that, the usual academic was it was a very good program for academics and also
Hmm.
research in Tata. So, and
Hmm.
it's in most of the institutes now, they are very rigorous about it with your journal club, seminars, and the usual case presentation also happening once. Each of it would happen once a week. So yeah, it was a busy first year, and like I think everyone's first year is just you are suddenly taken because you've been preparing and you haven't worked that much, and then suddenly it does get the initial months were a little hard. Then slowly with time we get used to it, and then the second year is about we get I in Tata there's a thing of sending us for the non-oncology outposting. We
Hmm.
were sent to PDM hospital for that, and so there we are rotated in pediatrics and the medicine department and the super specialty branches.
Hmm.
And also in Tata, the other departments where we get exposed to the medical oncology, radiation oncology, nuclear medicine, radio diagnosis,
Hmm.
and the even the rehabilitation, the physiotherapy, occupation therapy. We need to learn all that part. So
Hmm.
second year goes in some around 10 to 11 months goes in this outposting, and then third year again you're back in the palliative care department, and yeah, you're doing the same OPDs and OPD, IPD, respite, and everything. So till your exam, that's how it is. But we have this culture in I think that we our seniors and all we become independent quite quickly in our first year itself because of the exposure. We can take independent decisions quite earlier compared to other branches. So, like around maybe in 4 or 5 months, if your seniors know that they can trust you with the patients and everything, that usually we are. We just have to inform our decisions to the consultant and then or the seniors, and usually if anything has to be changed, they would tell us. And that I feel the learning curve is you learn things quickly, you become independent more quickly in taking decisions in
Hmm.
my branch.
Hmm. That's, that's interesting to know. But things are very different in respect, with respect to other branches that way. Taking decisions
Hmm.
as well as getting patient outcomes also is with chronic illnesses is a very different than when it comes to different. So that's interesting to know. So now understanding, how your PG days were, what do you think, and you are now doing, your pain medicine fellowship. What are the different kinds of fellowships that you will suggest students who are into, DNB or MD into palliative medicine? Apart from pain medicine, what is it that, you were also figuring out? Also, what are the, right places to go for? Because I'm sure you figured out for yourself as well. What are the right places to go for fellowships for pain medicine or any other, branches, if you can suggest?
Okay, so the reality of it is like since it's an end branch, so
Hmm.
post SRship, yes, I wanted to just complete it at one time, the find a fellowship for pain intervention, because I think it's important to it's not just conservative management is the first step. There are
Hmm.
some patients who can be helped with interventions if they are
Hmm.
referred to you earlier on. Okay, not
Hmm.
like very advanced stages, but and there are small interventions also like small blocks, small steroid injections, and everything that you should learn during your MD program. And so I think for the confidence to get to do those things independently, I wanted a fellowship. The
Hmm.
reality is that there aren't many fellowships where we are eligible. So
Okay.
that requires a lot of advocacy from our end, and yeah, we have to work on that. So I
Hmm.
am pursuing it in Kolkata,
Hmm.
and there are fellowships maybe in corporate hospitals under the pain department. You can apply for it and give maybe an interview and speak to them. They will be happy to have you on board because they do cancer patients in advanced stages. Like I said, it's not interventions are not always possible, but maybe earlier on you will learn. And then you'll also get exposed. If you do a fellowship in pain interventions, you're getting more of non-oncology patients actually, with
Hmm.
chronic pain patients. That will just enhance your knowledge. I mean, maybe we miss a case of fibromyalgia while just seeing cancer or something, those chronic conditions which you see, we forget, there could be a muscle spasm or something that could be really, there are small aspects that we can correct also.
Correct.
So we should know that. For that purpose, that's why I took a pain intervention. And if nothing, then at least you should know to refer to a pain specialist when you know that something can be done for the patient better.
Hmm. Hmm.
So for that purpose. Now, so besides pain, there are a lot of there are fellowships for pediatricians in pediatric palliative care, and also we are some institutes we are eligible for that. So if you want to specialize just in pediatric palliative care, there is.
Hmm.
And a lot of these courses are taken by very good institutes internationally, international curriculum, like over the week, like in neuro palliative care is a 1 year program. So long
Hmm.
distance courses, neuro palliative care, ICU palliative care, renal palliative care. So
Hmm.
yeah, if you want to just learn something very specific to enhance your knowledge in one particular branch, because now we have to expand in non-oncology also. We are, I think, in oncology we have a very strong foothold now, but in
Hmm.
non-oncology, it we need to get our colleagues also more, interested in referring to us or seeing our value there. It is there in a few hospitals like Manipal. I know they have a very good non-oncology and palliative care, integration. So
Hmm.
not seen everywhere. So we have to work on that part. And these courses will only help. Like the more graduates start taking these courses and they know that there are people who they can send these patients to, it will help.
That's true. That's true. It's just that, till now there are no people out there. So the
Hmm.
people don't know who to send. And definitely palliative care helps in every branch. So why, if there is somebody who can help, I'm sure this will start happening. So now understanding that, as you have been mentioning, that oncology is a very big part. Apart from that, there are now things are opening up with different branches as well, whether neuro, whether renal, whether pediatric. So how do anybody like you have passed out, or anybody who passes out after 3 years of their MD, and then understanding settling down, what do you suggest them, in looking at the current scenario, how do you suggest them, focusing on onco centers, or setting up their own practices? What do you suggest, how to figure out the right place to settle down, and what is your idea behind it, especially for yourself? Let's discuss, how do you think things should be thought when it comes to settling down? Because a lot of times people want to settle down in their tier 3 towns, and do you think for them picking up this branch makes sense, or if you're okay to settle down in metros only, then you should pick up this branch? What is your suggestion on
So I am still in the process of settling down. So maybe I am still learning what works
that?
out for me, what is not working out for me. So definitely you have to speak to your seniors also regarding, which place you want to go. Try to find out which city. Now, if you're based in a certain city or you want to keep continuing working there, then yeah, you will find in metro
Opportunity.
cities, it's more of corporate yeah, things are there. But like now, government institutes are still, you'll have to like keep asking them to start opening something separately for you. Otherwise, you're still working under pain as
Correct.
a consultant. If you want to work independently, you have these small challenges in metro cities. And like I said, this is very closely associated with oncology. It's still like in
Hmm.
non-oncology, we still have to catch up. A lot of catching up is required. So medical colleges, some of them, they are very open to hiring palliative care physicians. And so if you want academic, something very academic related, you
Hmm.
will have to look. But still, you can look for something in your city.
Hmm.
And I would prefer, as someone you have to see all the other things, the cost of living, everything when you're choosing a city also, the cost of living, the family aspect and everything. So you have to also discuss that with your, the people supporting you, what is best for you. And the salary matters. So corporate saving, like in, you might earn well in a corporate thing, but you should be able to save also. That is important. So and I would still, I'm open to going to second tier cities also if there's a good opportunity. If you have a balance, work life balance, I would really not have an issue with it.
Hmm.
And as there are more oncology centers opening in second tier cities, they definitely need palliative care physicians there. Because it
Hmm.
really does get difficult for them to handle once things get irreversible, and having those discussions, it becomes overwhelming if they have not been trained in their institutes, and usually they aren't. They do
Hmm.
need someone else to help them out with it. So you get
Yes.
opportunities, you meet people in conferences, they're like, please come and join and please help us out. There is
Hmm.
plenty of scope even in second tier cities. So you should
Hmm.
just be open to it, and you'll have to adjust at some point. That you can't get nothing will be perfect everywhere, so you have to be also open to
Yeah.
adjusting.
So that doesn't, so nothing is perfect with any branch, honestly. It's just that you have
Yeah.
to find your way out everywhere. Yes. And actually it's great to understand anywhere you find an oncology setup, you will find an opportunity. So with increasing cases of oncology, you find setups in tier 2, tier 3 towns as well. And that way, anybody who picks up this branch can easily find up their in their area the setup and actually settle there. That's again a very interesting topic. So now every branch has their pros and cons. Yes, you have been discussing about finding opportunities, job opportunities, as well as the kind of, it's still stuck with on the onco thing. What do you suggest the pros that you find every day, with the branch? What is it that keeps you going, as a practitioner, that you feel yeah, this is great in my branch? What do you suggest?
uh, on a professional level, like I feel like dealing with my patients, I learn a lot. It has humbled me a lot, this whole PG program and everything. It has developed my communications. As a person, I have grown. On a personal level, I have grown a lot. Because it really seeing so many people suffering, and you just kind of realize that maybe things in your life are very trivial compared to you see what is happening to patients because of the lack of their resources or the support they require. So
Mm-hmm.
that really keeps me going, and I want to keep getting better at helping a patient out in some way or the other. And they also, it's very rewarding when maybe your patient will not get cured. You will have to accept this right early. When you join, your patient will never get cured, but your patient's symptoms can improve a lot
Yes.
with your intervention. And when you see that happening, when you see a patient's pain going from like screaming to he's able to sleep at least, and he's having a peaceful, the last days of his life are peaceful, it makes a huge difference to the patient and also the people taking care of the patient. So they also come back to you and tell you that that's very rewarding, that that we come back and are very grateful for your help. That is what you will get. These are the rewards you will get. You will not see your patient getting better. And it is also very overwhelming in pediatrics. So
Hmm.
you can, it's actually very difficult there. I think at that age when we are young, it's very hard for us to understand also what parents go through at that time. But yeah, those when they come and tell you, because you also get involved in the whole care of a child, and you know that the child is getting bad, and
Yeah.
these things, these are small things, but they keep you going. Small moments in your career, that when someone comes back to you and appreciates your input.
Efforts.
And these are what keep me going. And personally, on a professional level also, I feel I now, since I've done with the academic part most of it, and also I get time for myself also in this branch. It's not a since I am leaning towards this private setup. Like I'm also
Hmm.
working in a private, so I do get there's more quality in that. I feel more than you get time to see a patient. Like you can spend a half an hour, 45 minutes just communicating. Your communication is the key, and that gets better, and you feel that then you've done something. When someone is just comes and tells you that thank you for listening to me, it really makes a difference. And you've given that time to a patient. As in a
Exactly.
high volume center, it's difficult to give that much time. So this is what is
Correct.
keeping me going for now.
Yes, yes. No, no, it's very interesting, especially the part that you mentioned that you are being able to do give maintain a work life balance is also a fantastic thing that I'm sure a lot of students look forward to as a branch. Having a work life balance is also a very important part of selecting a branch. So now, as you have already mentioned that you have you are able to have a good lifestyle with palliative medicine, and follow, and how is it going? So what do you suggest to the upcoming medical students who are sitting into the counseling and who are on their journey of selecting their branch? What do you suggest them how to go through selecting their branches firstly, and secondly, if they're planning to do it with palliative medicine, any suggestions from your end?
Okay. So the first one is to select a branch, right? So I think during if you've done your internship, the clinical part, you would have developed some interest in some branches, right? So
Hmm.
stick to that. Try to like you have to prepare really well during NEET. Now the exams get tougher each year, so prepare well. And when it comes to putting your preferences, I think that's what it matters. When if you depending on your rank, now that is also another thing that what cutoff has is required for a branch. You have to strive hard to get that
Hmm.
based on the previous thing, and then you choose the institutes. I would recommend that you always go and ask and check about the institute before enter, putting the preference order. See your priorities, which city you want, which the living conditions in the hostel, everything. All that is important when you choose write your list. The
Correct.
living conditions around the hostel, how whether the working hours, whether you will be just in the emergency or whatever. That's for clinical and non-clinical also. Yeah, I think you need to understand the scope and everything also before taking a choice, because then you're like you said earlier, you're married to the branch. Then you
Correct.
just have to continue doing it. So that is one thing that, and if you want to take palliative medicine, I would suggest also the same thing. Please reach out to us. We are all on LinkedIn or something. You'll find us on social media platforms. Try to visit the hospital and see, because I can tell you much more about the MD hospitals. DNB still I have met them, but I am not really sure about how everything functions. But I can't give you a very good information right. So if you are even interested in DNB, but I know they are very good institutes. So just go and meet the consultants. Everyone is very, so it's about communicating and being empathic, and so they with your patients, so they are also like that with their students. So
Hmm.
everyone is approachable. Go and meet them, talk to them, see what every institute will vary from each other in some way. It's not the academic program is there will be very some things really good in each institute. If that is what you want, again arrange your preference according to that.
Hmm.
Then choose a
Yes.
branch. But for a personal thing, you need to have these. You need to be strong a little bit emotionally to take this branch. You have to be a little tough, because the initial part will be a little hard to see so much of suffering or seeing all this thing. So empathy, you need to be empathic as a person, and you need to also be practical. You have to have a balance between these two things. So
That's right.
otherwise, you will keep getting burnt out. So this is something I think it's not something that only I won't say that women can't take or men can't take. You have to have a good emotional intelligence to take this branch,
Hmm.
because there are days where it will get really overwhelming for you also, and you need to just keep going through. If you're in academic, if you're doing your program, you will have to still finish it. So that is one thing that you need to discuss first
Yes,
with
yes,
yourself, with families, everyone for
that's
taking
true.
this branch.
No, that's very important part that you just mentioned, Dr. Pratna, is keeping you emotionally stable. Pick it up only if you think you can keep yourself emotionally stable. Also, if you really like this branch, do connect with doctors. Dr. Pratna is there. If you want our help, we can definitely connect with you to her. Just visit multiple institutes who have palliative medicine. See how, just visit it for a day or two, see how things are going there, because keeping yourself emotionally stable for your longer part of life is also very much important than not being able to manage yourself. So you need to know that if you can do that, then pick up this branch, what I think, because managing yourself emotionally is also a skill.
Yeah, and you actually need to have healthy ways to cope with it. It's not that I have been stable the whole time, but you have to have a threshold, develop a threshold with time. So that I have learned over my residency. So, but if you are someone who wants to just do something aggressive, save lives, then this go into that kind of something aggressive thing, then you will get disappointed very early. So make a informed choice, learn about it, read about it, see what actually happens, and then take it. It's very rewarding. I don't regret taking this branch at all. But yeah, I can also say that it might not be for everyone. You have to really take a very important, uh, a very good informed decision taking.
Hmm. That's true. And do proper research before taking any branch. In fact, not only palliative medicine. This because we not very well read during your UG days, so doing your research makes more sense around this. Also, if you do connect with doctors, with Dr. Pratna anytime, let us know. We will definitely connect. So,
Yeah.
lastly, wanted to know anything, any motivational quote or anything that keeps you going. Also, ways that you cope up with your everyday stress and your everyday juggling.
So I would like to just say that I mean, palliative care is more of an approach. If whatever branch you choose, you try to have this approach of seeing your patient as a person more, and seeing him as a, try providing understanding all the psychological aspects, and not just treating the disease. There are a lot of other aspects also that need to be correct. You can always, even if you don't want to take the branch, just try to be more empathic and practical at the same time while dealing with your patients. That is important. I think the approach is important. I think that will make us better doctors any day. We are here to serve. We have taken a very noble profession. So
Yes,
keep the approach in mind, irrespective of whatever branch you take. That's what
yes,
I would like to tell all my juniors who are trying to get into some professional courses now.
yes. No, it's very important, and you're absolutely right. During the run of the day, every day, you sometimes just forget why did you pick up this, and just reminding yourself this is also very important. And thank you so much for reminding this, and thank you so much for joining us, Dr. Pratna, today on a Sunday morning, helping us understand about palliative medicine. What exactly is this branch? Why did you pick up, and how do you see this evolving and the scope increasing day by day with the branch? So thank you so much, Dr. Pratna. Thank you
Thank
so
you so
much
much.
for joining us. And I'm sure this discussion will be very helpful for you understanding about the branch. Do share it with your friends, colleagues, juniors who are thinking of and are in that process of picking up a branch or are considering this branch. This might help them very well. And in case you want to connect with Dr. Pratna, let us know. We will be very happy to do that. So thank you so much, everyone. Thank you so much, Dr. Pratna.